friends, this is Soham Bera, consultant optometrist from India. Today I am going to tell you about Graves' disease. Let's start it with. Graves' disease is an autoimmune disease that damages the thyroid glands. Graves' disease affects more women than men. It is most common cause of hyperthyroidism, overacting thyroid gland. Symptoms of Graves' disease may include bulging eyes, weight loss, and a fast metabolism. Hyperthyroidism due to Graves' disease is treatable with medicines. So, who gets Graves' disease? Graves' disease is more common in women than in men. Women are most often affected between the ages of 30 and 60. Your risk of Graves' disease is higher if you have a family history. Second, have another autoimmune disease such as rheumatoid arthritis, type 1 diabetes, pernicious anemia or lupus. Experience severe emotional stress or trauma. Recently had a baby. Your risk of developing Graves' disease is high in the year after giving birth. This suggested that pregnancy might trigger or reveal Graves' disease in some women. Have a history of infection with the virus that causes mononucleosis. Smoking is also a leading risk factor for the eye problem seen in Graves' disease called Graves' ophthalmopathy. So, what are the symptoms of Graves' disease? Symptoms of Graves' disease include bulging or irritated eye called Graves' ophthalmopathy, thickening and reducing of the skin, especially on the chin and upper clit, irritability or nervousness, tiredness or muscle weakness, heat sensitivity, trouble sleeping, shaky hands, rapid and irregular heartbeats, diarrhea, weight loss without dieting, goiter, which is an enlarged thyroid that can cause the neck to look swollen. So, what is Graves' ophthalmopathy? Graves' disease can lead to an eye problem called Graves' ophthalmopathy. It affects up to half of people with Graves' disease. Graves' ophthalmopathy happens when cells from your body immune, what means defense system, attack the tissue around your eyes. This result is inflammation and swelling in the eye socket, causing the eyeball to bulge out. If left untreated, damage to the nerves in the eyes can also lead to blindness. Graves' ophthalmopathy is treated with eye drops and eyeglasses, radiation therapy or eye surgery. Your treatment will depend on how serious your eye problem are. So, how does Graves' disease affects women? Left untreated, Graves' disease can cause, first, problem with your menstrual period. Too much thyroid hormone can cause irregular menstrual periods and make your periods lighter than normal. Problem, say getting pregnant. Irregular menstrual cycle can make it harder for women with Graves' disease to get pregnant. About half of women with Graves' disease have a problem getting pregnant. Problem during pregnancy. Graves' disease can lead to preeclampsia, miscarriage and problem with the placenta. It can also cause problem for your unborn baby's development, including a fast heart rate, low birth weight and birth defects. Problem after pregnancy. Graves' disease often gets better during the last 3 months of pregnancy, but it may get worse after delivery. Thyroid storm. This is a very rare, life-threatening condition caused by too much thyroid hormone. This suddenly increases your heart rate, blood pressure and temperature to dangerously high levels. Heart problems such as irregular heartbeats, we call it arrhythmia, arterial fibrillation and heart failure. Last, bone loss that can lead to osteoporosis. So, how Graves' disease is diagnosed? To diagnose Graves' disease, your physician will do a physical exam and may do some tests including thyroid function test. This test check your blood for level of the main thyroid hormone T4 and thyroid stimulating hormone TSH. A high level of T4 plus a low level of TSH is a sign of overactive thyroid gland. Radioactive iodine uptake. RAIU test. This test tells how much iodine the thyroid gland use to make thyroid hormones. Higher level of iodine suggests Graves' disease. Antibody test. This blood test look for antibodies that suggest Graves' disease. So, how is Graves' disease treated? There are three main treatments for Graves' disease. Anti-thyroid medicine. This medicine skips the thyroid gland from making too much thyroid hormone. They are often given to patients before thyroid surgery or radioiodine therapy. Radioactive iodine. Radioactive iodine is a type of iodine that destroys thyroid cell so that your thyroid gland cannot make a much thyroid hormone. This causes the overactive thyroid gland, but it can lead to underactive thyroid gland. If this happens, you will need to take thyroid hormone for the rest of your life. Surgery to remove all or most of the thyroid. As with RAI surgery causes overactive thyroid but can lead to unpredictable thyroid. Friends, this is all about Graves' disease, but we are going to discuss about Graves' ophthalmopathy in our next episode. So friends, if you like my video, please like, share or subscribe us, and please stay safe, stay healthy. Bye.